John, I'm happy to have you here.
How you doing, Dr. Arzate?
Fantastic.
Good to see you.
Good to see you.
Thank you for having me in Cancun at your beautiful clinic.
Thank you.
I appreciate it.
Is there different levels in implantologists? What do you think, John?
Well, there's certainly different skill levels in implantologists. You know, with today's plethora of choices of implant dentists out there, you should be careful on how you choose an implant dentist, one who has adequate training and maybe also one who has proven to himself and to the academies that he's credentialed in implant dentistry at a certain level. He has a certain understanding and expertise in this field.
You don't know how many patients they ask me, hey, should I pick this doctor or this doctor? Which one's best? What do you think would be like a good thing for a patient to search on that doctor?
Correct.
And to say, hey, I want this doctor or that doctor
Correct.
to perform my implant or my full mouth rehab.
Well, that's a very important decision, and they should do some research. They owe themselves the time to do research for the proper person who's going to treat them. So number one, he should be clinically skilled. He should probably be credentialed with either his academy or some specialty field, so they understand that he's at a certain level of experience. They should talk to other patients or read reviews from other patients to understand his work, and then do a little investigation into the facilities, staff support, and the location and the technology that he uses.
And now, do you think that there are like 3 levels in implantologists? Can we make them like that, like in 3 different levels, based on your experience? What do you think?
I think you could almost make it into 3 levels. You could make it into the doctor that's proficient or familiar with the restorative aspects. You know, that means the caps, the bridges, the dentures that go on implants, because that's important. They may not be involved with the surgical part. You can have another doctor who's really just involved with the surgery part himself, or you can have some doctors who know both surgery and prosthetics, and they could be at different experience or expertise levels.
So that could be like a basics level 1?
Yes.
That's what you can say. And what could be level 2?
Well, level 2 is a person who's now doing implants more routinely, maybe simpler cases, straightforward cases, maybe not full mouth rehabilitation type of cases, right? Mm-hmm. And then the top would be that person who understands full mouth occlusion, full mouth facial aesthetics, smile rehabs or smile makeovers, and has a better understanding of extensive surgery.
And level 3 on your experience?
Well, that was my level 3. It doesn't get higher than that.
Well, when you combine implantology with full mouth rehabs, with smile makeovers, or when you do like when you do training, or when you do
when you're
exactly
like when you're a teacher or faculty member,
faculty member, where you credential like a board certification, like
key opinion leaders, experts in the field. Correct. Yes.
And now, amount of implants. If we were talking about amount of implants, because sometimes patients, they don't know how many implants your doctor has placed.
Correct.
So in our experience, in your experience, what can you say about that?
I mean, you'd want to choose a dentist, obviously, who's placed a number of implants so they have some experience. I mean, someone who's placing them more routinely is going to be someone more experienced. You know, not the person who just does 1 or 2 a month, but several a month at least. But then again, I don't think it's just important on the numbers alone, because if someone was just placing a lot of implants, over 10,000, but they were not in proper position, or it's not very good restorative, it really doesn't much matter. So you want both quality and you want proficiency, so they know how to do it.
You think there's a difference with doctors that only place implants and doctors that place implants but also restore implants?
Well, I have to say I'm a little bit biased in that, because I think the doctors that understand the restorative or the prosthetic aspects to the implant dentistry are better surgeons themselves, because they understand implant positioning, they understand the pressures, the loads, the longevity, the post-operative healing, etc. Although there are very good specialists that work as a team, so you want to make sure you're in that good team.
Totally agree.
Yep.